Esteemed colleagues, today I would like to discuss the importance of taking a comprehensive history and asking the right questions when evaluating cervical spine pathologies. Effective diagnosis lies in our ability to identify key symptoms and correlate them with potential underlying conditions. To aid in this process, I have organized a set of folder questions categorized by the suspected pathology. Let us delve into these questions, as they will serve as a valuable tool in our clinical practice. Radiculopathy. We begin with radiculopathy, a condition characterized by nerve root compression or inflammation. The first question in our folder is, do you have pain with coughing, sneezing, or straining? This inquiry aims to uncover a potential Valsalva effect, which may indicate disc protrusion or extrusion. However, it is essential to note that the absence of a Valsalva effect does not eliminate the possibility of disc pathology. Moving on, we ask, do you have any numbness or tingling anywhere in your body? This broad question allows patients to disclose any paresthesia they may be experiencing, without limiting their response to a specific area. Patients may sometimes overlook seemingly unrelated symptoms, making it crucial for us to ask comprehensive questions. Next, we inquire, are you dropping things? This question can reveal motor or sensory deficits, which may stem from peripheral neuropathy, radiculopathy, or myelopathy. It is essential to follow up with specific examples to better understand the nature of the patient's symptoms. Furthermore, we ask, have you noticed any weakness anywhere in your body? Patients may not always associate their pain with weakness, so it is our responsibility to identify any signs of weakness, such as difficulty raising their arm, supporting their body, or tripping or stumbling. Finally, we address scapular pain by asking, do you have scapular pain? If the patient responds affirmatively, we follow up with, is the pain between the shoulder blades, under the shoulder blade, or on top of the shoulder blade? This clarification helps us pinpoint the location of the pain, which can be indicative of specific nerve root involvement. 2. Myelopathy. Turning our attention to myelopathy, a condition characterized by spinal cord compression or dysfunction, we begin with a series of questions aimed at assessing fine motor skills and coordination. Do you have any difficulty picking up keys/coins off of a level surface? Do you have any difficulty with buttons? Are you having difficulty using a mobile phone? Do you have any loss of speed or dexterity on a keyboard? These questions can reveal early signs of myelopathy, which may manifest as clumsiness or loss of dexterity. Next, we ask, are you having any balance difficulties? Patients with myelopathy may describe bumping into door jambs, furniture, or people, or they may simply state that they have become clumsy. It is essential to inquire about the duration of these symptoms, as a sudden onset may indicate a more serious underlying condition. Moving on, we ask, do you have any temperature changes in your legs? Patients with myelopathy often report sensations of coldness, cold water, ice water, or an icy sensation traveling down the spine and into the lower extremities. This symptom can be elicited with active range of motion of the cervical spine, and it is important to note that a warm sensation is not indicative of myelopathy. Another crucial question is, do you have any electric sensations in the spine or legs? Patients may describe an electric sensation down the spine and lower extremities with cervical flexion, a phenomenon known as Lhermitte's sign. However, it is essential to differentiate this from radicular symptoms, where patients may report electric sensations in the upper extremities. Finally, we ask, are you having increased urinary frequency or an inability to urinate? Increased urinary frequency can be a sign of myelopathy, and it is crucial to investigate this symptom further. 3. Instability. Moving on to instability, we ask, do you have clicking and popping in the neck? Also note if the popping and clicking is with/without pain. Clicking and popping may indicate cervical instability, and it is essential not to dismiss these symptoms as simple cavitation from self-manipulation. 4. Facet-mediated pain. Lastly, we address facet-mediated pain by asking, do you have cervical pain from the cervical compression test? If the patient reports cervical spine pain and upper extremity pain during this test, it may indicate facet joint involvement or an intraforaminal protrusion that has not yet affected the spinal nerve root. In conclusion, a comprehensive history and targeted questioning are essential for accurate diagnosis and effective management of cervical spine pathologies. By utilizing these folder questions, we can systematically investigate potential underlying conditions and provide our patients with the best possible care. Remember, these questions serve as a guide, and it is our responsibility to adapt them to each individual case, ensuring a thorough and personalized approach to patient evaluation.